But carpal tunnel syndrome is the result of nerve called median nerve that's run through the wrist is compressed, and it leads to the nerve dysfunction. And that median nerve dysfunction shows up to the patients as a numbness and painful numbness, usually in the we call radial thumb half of the hand and the bottom part. And they can occur usually in form of occupation. So if you do a lot of wrist movements or put direct pressure on the palms of your hands, then you make the space where the median nerve runs compressed, and that can cause these pressure symptoms. And they can also occur during time of pregnancy or weight gain or swelling, when the space the nerve has traveled gets filled with a lot of liquid and there's less room for the nerve. And why does this space occur? In the wrist, the nerve travels in a space called carpal tunnel. So the carpal tunnel is a region of the wrist where the wrist joins the hand. And in this region of the hand, there are several bones called carpal bones. And they're all attached. It allows your hand to do whatever it needs to open up, but also holds together, and the back end of it forms the U shape of bones. So multiple bones make up this U shape, and they're called carpal bones, and they're in this region. And the ligament that keeps the bones together is called carpal ligament. So they runs from here to here, from the thumb to the other flesh part of the hand. So thenar and hypothenar we call eminence, so they stick out. So the ligament runs like this. And underneath that runs the median nerve, or the carpal tunnel nerve, and that goes sensation and hand movement of these three parts. The basic problem is the space, the carpal bone and the ligament is too small for the nerve. So whatever condition that leads to that causes a nerve to be trapped in that area. Treatment is avoiding the activities that leads you to that. Many times, unfortunately, we can't get pregnant, but if you can deliver a baby, it may go away. But many times we have jobs that we continue to have to do it. And so if the measures to avoid the activity doesn't work, then we often lead to surgery. And there are different ways of doing surgeries, and all achieved is we cut the ligament that makes a space as a complete tunnel. So when you bone, we can remove, but we cut the ligament so the space gets a little opened up. And that is usually enough to relieve the symptoms. Now, the two approaches of relieving this are open surgery, where we cut through the skin, through the tendons of the wrist and the muscle. The ligament, carpal ligament, and that opens up. The other one is what we call endoscopic, where you make an incision above and beyond the ligament, and you put a tube in there and then cut it from underneath. So at the wrist area, there's no cut, but you got two cuts above and below the wrist. So they have advantages and disadvantages, and these are done by many fields and doctors. So we, being a neurosurgeons, we think we do a good job. Plastic surgeons that deal with the hands, and they say they do a good job. Orthopedic surgeons who deal with the wrist and hand injuries think they can do it. So it's being approached by many surgeons doing this carpal tunnel release. It's a simple outpatient procedure. By doing an open surgery with a small 2-centimeter incision, we can achieve a complete release of the carpal ligament. That's basically why I think any neurosurgeon should be able to do the job.